or it's stress. Like stress causes it. And it's really funny because in the top 10, cholesterol didn't show up in the top 10, hypertension didn't show up in the top 10. But all of the stress factors did. If you lived in an area that was a high crime area, um, then you were more likely to get heart disease. If you had mental illness, serious mental illness, whether it's depression, anxiety, schizophrenia, bipolar, you were much more likely. That was in the top 10 risk factors for heart disease.
Wow.
So, it's not simple oh, if you just eat this, and all these people that are promising that, your heart will work great if you take this drug or take this supplement or whatever pill, it's not a pill thing, it's a stress thing. So sleep is an important thing. We should do one whole thing on just the stress part, because if you have heart disease and you're in the Healthy Heart Solution Kit, if you've looked at that, we talk a lot about stress, about what to do about it and all that kind of stuff.
Yeah.
And so it turns out, in the conference, it's so clear that stress is the problem and not all of the things that we attach as problems. So yeah, people who are stressed are likely to have higher blood pressure, right? So, okay. So is blood pressure risk factor? No, the stress is that causes the high blood pressure. People who are under a lot of stress have a lot of other problems like insulin resistance. That's what we're going to talk about today.
And it's, we've got to be honest. I'm not saying the people on the webinar feel this way, but many people want a quick fix to health conditions. And so I think there's this part of us that says, we don't want to find out that stress is the issue. We just want a pill, right? We don't want to have to deal with stuff. It would be a lot easier to just take something. But that's not getting to the root cause of what's really going on.
So Elliot says, I reduced my stress by retiring last month. Do you know what, Elliot? Retirement is a big stressor. The change from I have something to do every day to I have nothing to do every day is actually stressful. And you're more likely, and it's a big, retirement is a big risk factor for getting a heart attack. So if you're in retirement, Elliot, make sure you have something to do. Like you say, okay, I'm retired from this, so I can start this. And then you have a project and you have a reason to get up in the morning. That's really important.
That's really good. I have gone through seasons where I wasn't working as much, and I found that that was difficult. I learned a lot about myself in those seasons. I found that I do better having things going on. It keeps me on a schedule, which is very interesting. So I'm not of retirement age yet, but
Well, I
something to
almost
plan
am,
for.
but I don't think I'm ever going to be retarded.
Never going to be retired.
No.
You probably won't. You will always be doing.
No, I love what I do, and I'm just going to keep doing it. As far as I know, I don't know.
Yeah.
Maybe
Okay.
they'll finally revoke my license for good. But then I'll keep doing it anyway.
Yeah. We need you. You can't be done. Okay. We want to talk about type 2 reversal today. Boy, we are finding more and more people are getting diagnosed with type 2 diabetes or they are pre-diabetic. What are the numbers these days, Dr. Saunders?
It's about 1/3 of the population. 1/3, like 1 out of 3 people that you're seeing out there has either diabetes or pre-diabetes.
Wow.
Yeah,
Wow.
it's big. It's huge.
And
Literally.
so it's important to talk about this. And
One
there are
time I
many
came
options.
home. One time I came home and I told my wife, that I saw a ton of patients today. And she's like, literally, yeah, I did.
Okay, so if we were to go, first of all, this is what I want to start with. how do I know if I might be heading in that direction? What are some things that I need to notice, or some things I might find in my body as symptoms of type 2 or high blood
Okay.
sugar?
Yeah, things that you could look on the outside. So the classic is if you're peeing a lot, right? Is so you have to get up at night 5 times to pee, and then all day long you're drinking water, peeing, drink, pee, drink, pee, drink, pee, because the word diabetes literally means peeing a lot. Someone who's urinating frequently. So that's where the name came from. So that's the classic symptom, but that's a late sign. That's like you're way down the road by the time you get that sign. If you want to know early signs that you have, just look at your belly, your waist size. If you measure your waist size and it's getting bigger, then you probably have high insulin. You're getting insulin resistance because insulin causes fat in the abdomen. So it's called visceral fat, fat around the organs. And so it pushes the belly out. And so if you have a waist size that's enlarging, the waist is around just above your hip bones to your belly button. So if you measure right around there, and it's bigger than 34-ish, and the rule is that you can have a belly about it should be less than half of your height. Sort of. Anyway, these are all kind of just general kind of measurements, but really, any man should be 34 or less. 32 is kind of optimal. Any woman should be around 30. So it depends on a lot of different things. But if it's getting bigger, you probably have insulin resistance. And then number two, if you've ever seen the dark discoloration of skin, like in the folds, it's common around the neck where there's a lot of rubbing, like around a collar or in the underarms, where there's a lot of rubbing, you'll see this darkness. And people go, oh, I just scrub and scrub and scrub and it won't come off. That's because it's pigment. And that's a sign of insulin resistance. Another one would be getting skin tags. That a lot of people don't know this. Insulin is a growth hormone. It tells your body to grow and it makes your skin grow. And when your skin grows and it doesn't have anywhere to go, it makes these skin tags. And a skin tag is like a little ball of skin that has a little pedicle, it's called, that goes to your skin. So here's your skin that's got a little pedicle, and then and so some people get a ton of them, like they're all over the place, and that's a sign of insulin resistance too. So if you see those, then you may have early insulin resistance, and you should do something about it.
Very interesting. I'm going to show a picture actually of that because I didn't realize that. That was something that I learned the last time you brought this up, which was just a few weeks ago, I think. Oh, can I really not share this? Oh, there we go. So here you go. You can kind of see not very big pictures, but let's see if there was another one. No, there wasn't. But
Yeah, and they usually show up where there's rubbing, So like here you can see it's in the antecubital fossa or in the arm where it bends. The back of the leg where it bends, or in the underarms, around the neck. These are where there's rubbing.
Okay.
These are going to show up, and then people get the darkness too, acanthosis nigricans.
Interesting.
Yeah.
Okay, so let's say we're starting to notice some of these things. We decide to go maybe the traditional route of going to the medical doctor. What are they going to do when we get into the office?
Okay, so the medical doctors generally, now this is actually improving a lot lately, but typically the older doctors at least will look at everything as a yes or no question. Yes, you have diabetes. No, you don't have diabetes. And so if you have pre-diabetes, so they do tests. So the first thing, you go to a doctor, they're going to test you. And they're going to test your blood sugar. Your blood sugar is going to be 103. And between 70 and 90 is optimal. Up to 99 is considered normal. 103 is barely. And they'll go, yeah, your blood sugar is a little bit high. And your hemoglobin A1C is 5.7. And that's kind of like, yeah, it's on the lower edge of pre-diabetes. And so what they're going to say is, watch your sugar. Don't eat too much sugar. Bye. And that's all. And then if they test again and you're like 6.5 or 6.6 or 7 hemoglobin A1C, then they're going to go, you have diabetes. Here's a drug. And that's typically the way it's done. So there's a line. Once you cross the line of 6.5, then you get a drug. And before that time, it's like, watch your sugar. And so there's some advice here. Instead of that way, a nicer way to look at it is a scale. So you see, where are you on the scale? Your hemoglobin A1C is 5.0. That's great. Now let's look at your insulin levels, because I've had people with normal hemoglobin A1C 5.0, which is like perfect, but their insulin is 30. And that is a huge risk. And so they get this acanthosis nigricans, they get skin tags, and it's because of the insulin. And all of the problems that we associate with diabetes or type 2 diabetes, are not problems with sugar, they're problems with insulin. So it's insulin that causes the Alzheimer's disease and neuropathy and kidney disease and heart disease. That's all an insulin problem. And so when you just look at the sugar and the hemoglobin A1C, it's like, la-di-da-di-da, everything looks good. But if you never test for the insulin, you don't know. And so I had a guy a few weeks ago, came in for the first time, got his test done. His test came back, and he had renal failure. And I'm like, oh, look, you have diabetes. You have renal failure. He goes, what? I've never had diabetes. I've been tested and tested. His blood sugar was always normal. They never tested his insulin. They didn't know he was insulin resistant, and it was causing kidney failure. And because all they tested was his blood sugar.
Wow. Okay. You often mention tests that you like to see. I don't know that they're normal, that people check for these, but what are the 4 tests that you recommend that people do?
Okay. Hemoglobin A1C, blood sugar. Almost everybody does those. Or glucose level, which is sugar, right? Glucose. And then insulin and C-peptide. Insulin is the immediate amount of insulin you have. On a fasting specimen, it should be around 5. And the C-peptide is the amount of insulin that the pancreas is putting out. It's more of a long-term, it's more general than the specific immediate amount of insulin that you have that only lasts for minutes in the body. So the C-peptide level tells you how your pancreas is working, or how much your pancreas is working. So for example, let's say you have type 1 diabetes and you're injecting insulin, and you do those 4 tests, and your glucose is 150. Okay, it's a little high. Your hemoglobin A1C is 8. That's pretty high. Your insulin level is 50. And I've seen a case like this recently. And so you have a lot of insulin with a high glucose, and your C-peptide is 0. So if the C-peptide is 0, it means your pancreas is not working at all. That all of that insulin that you're measuring is from what you injected. And you have a lot of insulin resistance. So you have type 1 diabetes because your pancreas is not working. You must inject insulin, but you have insulin resistance. So you have, it's just a setup for getting kidney failure, Alzheimer's disease, and all the complications of diabetes. So you still have to do phase 1 of the program, even if you're type 1 and it went under those conditions. But you wouldn't even know that if you didn't do the tests. So you have to do all the tests to know if you even need that. So let's look at another situation where somebody has their hemoglobin A1C is 5.0, perfect. Their blood sugar 78, perfect. Their insulin level is okay. Their insulin level is 30, and their C-peptide is 5. So then you go, wow, you have perfect blood sugar, but really high insulin. You're in big trouble. You have to do phase 1 of the program, and you do not need to inject insulin because your pancreas is putting out a ton of insulin. That's why the C-peptide is important too.
Okay, I know that there was a comment. Let me just see. Okay, so in the Q&A, Cheryl had sent us a message, said that she's been working on her program for the last 2 months. She got her lab work back and will be meeting with her doctor next week. But these are the labs from the middle of December. So fasting insulin, 6.3. Lipid test, cholesterol 365, triglycerides 255, A1C 15.7. Okay, and then fructosamine 600, C-reactive protein 0.97, fasting blood glucose 925. Let's just
295, 295, 925 would be really high.
That'd be a lot. Okay, so let's have you talk about those numbers first, and then there's some more that she had written, I think.
Okay, so here you have an issue. Fasting insulin is 6. So the pancreas is making insulin, but it's not very much because the A1C is 15 and the fasting blood glucose is 295. So when you have a glucose of 295, you better have a higher insulin level. And what that means is that the pancreas is not putting out enough. And so that would be a reason for being on insulin. But there's another way to look at this. And that is, if you look at your fasting insulin as 6.3, that is a normal fasting level. So you can go off of glucose, take all the glucose out of your diet. So doing phase 1 of the program, read the book, do phase 1 of the program, and you take all the glucose out of your diet so that you don't have any excess glucose, and you start exercising. Exercise is like a dose of insulin. Your muscles will take in glucose without needing any insulin. So that you have some insulin that's going to work for like your brain to function, all your body to function, all your fat cells to function. Everything's going to function. So you don't need to inject insulin because your pancreas is actually making insulin. Now, number 2, you need some more tests to find out if you have insulin antibodies, islet cell antibodies, any of the autoimmune diseases that are associated with the pancreas pooping out and not making enough insulin. So your next step is to test, and at the same time, start on phase 1 of the program. Take all the glucose out of your diet so that you don't need to inject insulin. So injecting insulin, might be needed at some point. But getting your hemoglobin A1C down to 5.4 or less, and your A1C is 15, that means your average blood sugar is in the 300s, like average. So this 295 is probably a low number for you. Start on phase 1 of the program, get tested for insulin antibodies. And that's all, not just insulin antibodies, but islet cell antibodies, all of them. There's a whole panel with GAD65. There's a whole bunch of tests that the panel that needs to be done for that. Because if you have autoimmune diabetes, then that's a fixable problem. You can fix that, and your pancreas can start working again. Um, and then phase 1 of the program, do the tests, find out what you have, and that's the best way to start.
Right. Love it. Okay, that's good. I want to talk about this a little bit. This is the Diabetes Solution Kit. This is the book that you can get at bartonwebinar.com. And you can get this hard copy. You can get the digital version of this as well. But when we talk about do the Diabetes Solution Kit or do the kit or the solution kit, this is what we're talking about. This goes through all of the steps that you need to do. So, how many carbs you need to eat, that's what we're talking about when we're talking about different phases, how to eat. We talk about, there's recipes in here, talks about exercise. We talk about testing. There's some meal planning, etc. This is where you want to begin. And guess what? You can get that for under $20. So it'll be the cheapest thing that you ever do. But just so that you guys are aware, that's what we're talking about. Okay, Regan said, I just finished my February 72-hour fast at 12:30 Eastern time, and I had lunch about an hour and 45 minutes ago, and my blood sugar is currently 77.
Wow, beautiful. So 70 to 90 is perfect. So that's where you want to be all the time. Very good. Good work.
Love it. Okay. Anonymous says, thanks to you all, my A1C was 7.9. I started with your program 3 months ago. I lost 14 pounds, got a continuous glucose monitor, rechecked A1C, and it was 7.0. My morning glucose was 154 to 160, not now, I think 116 to 124. I'm so happy for all of your info. I never took the metformin that the doctor prescribed.
Yeah, okay. A1C 7.9, was 7.9, now it's 7.0. Good work. That's a good start. Remember,
Yep.
you're shooting for 5.0 to 5.4. That's where you
Yep.
want to be. Okay.
And those numbers are going down, so that's good. You're on the right path, which is
Yeah.
awesome. Keep us updated. Okay. John says, what are the best ways to control or lower insulin?
Okay, that's a great question. So there are several things to consider in this, and one is, why do you make insulin in the first place? So your body makes insulin every time you eat. You release insulin. So if you eat, if you take like 2 tablespoons of coconut oil, you're not going to release insulin, right? You just don't make insulin from eating oil. So if you were to drink a cup of olive oil, that's a lot of calories, but you're not going to release any insulin from that. However, if you add anything into that, and protein can cause you to release insulin, and then carbohydrates cause you to release more insulin. Fiber does not, by the way. Fiber doesn't cause you to release insulin. It's really cool. The system is so awesome, you would not believe it. You get sensors in your intestines that know what you're eating. And it starts with your sense of smell. When you smell pizza, you make certain enzymes that are very different from when you smell broccoli. They're different enzymes to digest them, and your digestive juices will be different depending on what you're eating. So if you're eating meat, it's going to be different than if you're eating rice. There's different digestive enzymes for each one. And then the sugars too starts with your taste bud. Well, it starts with your nose and your taste buds. You taste something sweet, and the pancreas goes, "Aha, sugar's coming down," and so starts preparing your body for receiving sugar by making insulin. So even the taste of sweet, and we've had people on this program say, my blood sugar did not come down until I got off the sugar-free gum that I was chewing. Yep, because the taste of sweet will cause the release of insulin and insulin resistance. So, the digestive juices, including insulin, are made according to what you're eating. So every time you eat, you make insulin. Every time you eat carbohydrates, you make a lot of insulin. Every time you make protein, eat protein, you get a little insulin. Uh, and and when you're stressed, you make more insulin. So you get actually more insulin resistance. So you get higher blood sugars, and then your pancreas puts out more insulin because the stress hormones, cortisol, make you insulin resistant. So when you eat fat, you get insulin resistant. So if you eat pure fat, you don't get any insulin. But if you eat fat and sugar together, that's a terrible combination because the fat's going to make you insulin resistant and the sugar's going to raise your insulin, well, raise your sugar level and raise your insulin level from that. But you're insulin resistant, so it's going to make it worse. So the very worst thing anyone could eat is putting fat and carbs together. So we never do that, right? Think about it. In nature, are there any foods with fat and carbs together? No, nothing. An apple has no fat, got a lot of carbs. Oranges, no fat, a lot of carbs. Avocados, lots of fat, no carbs. Meat, lots of fat, no carbs. You just do not have anything in nature that is high fat and carb together. So why is that? Well, they're terrible things. And so what do we do in modern society? We put fat and carbs together. Yeah, I got this great baked potato that I put a quarter of a pound of butter on it. Yeah, that's great, right? Or a few spoonfuls of sour cream on my baked potato, right? That's the way to eat it. And we put ice cream, right? What is ice cream? Sugar, fat. Put them together. Cream is fat and sugar. You put them together, and that makes you insulin resistant better than anything else. Frying anything, donuts, all these fried foods. Have you ever squeezed a donut? Take a donut sometime, just a plain donut, and squeeze it, and all the fat will drip out, all the oil. And it's just carbs and fat, sugar, fat together, bad combination. So never eat anything that is sugar and fat together. So don't put butter on your toast. I'm terrible, huh?
I mean, what's the point of eating toast then? Just don't eat the toast, right?
Well, his question was, how do you get the insulin levels down?
Yeah.
And I'm explaining that's how you get the insulin levels down.
Yep. All right. Gary said, what are the best numbers for the 4 tests?
Okay, so hemoglobin A1C should be between 5 and 5.4. That's a decent one. If it's 4.8, that's okay. So I say 4.8 to 5.4, somewhere in there. That's good. The fasting blood sugar, glucose, should be between 70 and 90. If it's higher than 90, then you have some insulin resistance. If it's 100, so technically the lab will say that's normal, but it is normal, but most people have some insulin resistance. So if you have no insulin resistance between 70 and 90, fasting. The C-peptide should be 1. It might be 0.8 would be okay. 1.2 would be okay. It's kind of a narrow range. But when you get up to 2, you have twice as much insulin as you should have on a fasting. And 3 is 3 times as much, 4 is 4 times, 5 is 5 times as much. So, you know, it's a pretty narrow range there. And then the insulin level should be right around 5. Less than 6 is good. So if it's 1, 2, 3, 4, 5, somewhere in there is fine. And technically the lab is going to say it's like less than 10 is considered normal. Some labs I've seen less than 15 or 20 even. So it depends on the lab, but either way you look at it, if you have no insulin resistance, it should be around 5, less than 5, or around 5. Because if it's 6 or 7, that's okay.
Okay. I'm going to actually share that. Okay. Mirabella said, when using Easy Relief Magnesium Spray, Would massaging it into the skin increase magnesium absorption versus just spraying it on the skin? If one has a Charlie horse, is that a sign of low magnesium? And would using the spray help alleviate the leg spasms?
Leg spasm. Okay, so the first question, massage. Can you massage it in to make it absorb better? Possibly. Drying it on the skin, you get a small amount of absorption, but there's a lot more factors that are involved in that, like how warm your skin is, how much of the blood vessels are dilated near the surface of the skin. So I guess, if you're massaging and you're causing friction and dilating the blood, that might help. Yeah. And then the idea that you can spray it on a local, like on your leg, you're having a spasm there, and you spray it on locally. It's not the way the body works. The body has layers. So you have a skin layer, and then you have a fascia layer, and then you have a muscle layer, and things don't go through the layers very well. So they can get into a layer, and then they get dissipated so right under the skin is the lymphatic system. So the lymphatic system carries that into the blood system and goes systemically. So, and it doesn't just go like through the layers into the muscle layer, right? So I don't know. People say they use it, they massage it in and their muscles relax. But you know what? Getting magnesium can relax muscles, just taking a pill does too. So I don't imagine the Easy Relief spray is a better way.
I use mine. I don't recommend touching it with your hands. It feels kind of weird afterward. But
They
if
used
you,
to call it magnesium oil because of that, even though
yeah,
it's not an oil.
um, I will just go like this. If I put it on my arms, I'll kind of do this and rub it in that way a little bit. But it'll leave a weird feeling. So
Yeah,
yeah,
yeah. But if you massage it in and then rinse your hands, yeah, that
yeah,
way.
you're fine then. Yep. I just don't usually feel like getting out of bed after that. So, because I use it at night. Okay. Let's see. Tom said, had my quarterly checkup last week. I asked my medical doctor for insulin level and C-peptide tests, and he refused because he said they weren't needed. Should I go to an independent lab?
Absolutely. If you have type 2 and you're having trouble getting those tests, go to an independent lab. Yeah, and just do them. You need to know.
Okay. Daryl said, as my day progresses and the body systems do all their work, which causes spike in my sugar readings. However, at my morning fasted reading levels, my levels are in the 90s. Is it safe to say my body is properly processing glucose?
But it depends on the spike. If yeah, you're morning fasting in the 90s. I don't know what the spike is though. So if the spike is 150, then no, you're not processing glucose very well. Um, but if the spike is at 110, then yeah, that's fine. That means you're probably doing pretty well. So it really would depend on what that spike was.
Gary says, is eating an apple with almond butter worse than just the apple?
No, I think it tastes better.
Oh,
uh, but yeah, in the sense of the almond having fat in it and making you somewhat insulin resistant, and then the apple having the sugar in it. So mixing the sugar with the fat. Yeah, we do that all the time. You take peanut butter, for example. It's got a lot of peanut oil in it. And then we mix it with we put some jam or honey or something on our peanut butter sandwich, and it's good. It's good. Totally, I agree. I love peanut butter sandwiches, and I love apples with almond butter. But it's not healthy to mix carbs and fat.
all right. Tom said, do the 4 tests need to come from the same blood draw?
No, no, you can get them. The two of them should be fasting. Wait, the insulin C-peptide and glucose should be fasting. Hemoglobin A1C doesn't matter. So Yeah. But as long as they're fasting, it doesn't have to be the same blood draw.
Okay. Kimberly said, are baked potatoes good for diabetics or pre-diabetic person?
Um, it's interesting. Baked potatoes have more potassium than anything else, and they're not bad. However, when they get mixed with fat, they're really bad. So, putting butter or sour cream on a baked potato is really bad for type 2. And then generally avoiding starch because, gosh, 20 grams of carbs from a potato, you get very little bit of potato to get 20 grams of starch. 20 grams of carbs. It wouldn't be worth it.
Cheryl says, is C-peptide the same as C-reactive protein?
Good question. No, 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 no. There's a lot of C's when you're doing testing. There's a cystatin C, which you should also probably do to test your kidneys to see if your kidneys are functioning well. And then there's C-reactive protein, CRP, which is a marker for inflammation or cellular distress. And then there's C-peptide, which is the C portion that is the end portion of the peptide that where insulin is made, and then there's an end of the peptide that gets cut off after it's released into the body, and that's the C peptide. So no, they're way different.
Okay, Terry says, Dr. Saunders, this means we cannot eat any dessert because it's either fatty or sweet.
I know, no, 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 no. It's not either or, it's both. It's like every dessert, right? What is cake? Cookies. They're fat and carbs put together, right? That's what they are. Frosting is like pure fat and sugar. So yeah, you can't have any dessert because pie was that you mix butter and the graham cracker crust. Oh, I love graham cracker crust. And then what do you put in the pie? You put I don't know, key lime pie is like um, what is it? Cream and you whip it up. And it's got some protein, some eggs, and then a lot of sugar in it. So yeah. Any kind of dessert that you look at is going to be off the table.
All right. Anonymous says, to piggyback off the magnesium question, which is better, magnesium threonate or magnesium glycinate?
Okay, so they're both about the same. They're both magnesium glycinate. They say is they call it neuromag because it gets into the brain. Well, all of them get into the brain. Magnesium threonate does too. Magnesium glycinate is a little better absorbed than a magnesium threonate. But these are all chelated magnesiums, whether it's magnesium citrate, glycinate, threonate, um, magnesium aspartate. You can get a whole bunch of different types of, of magnesium chelates, but there it doesn't matter. It doesn't really matter. You could get magnesium oxide and just take a higher dose, and you get about the same amount of magnesium, the elemental magnesium in your body, and your body uses it. So it's not that one is better than another. It's like, oh, this is better absorbed. Well, that may be important for some people. So you might want to take magnesium glycinate because if you take magnesium citrate, you don't absorb as much of it. And some people get diarrhea because if they don't absorb it in the small intestine, it goes into the large intestine, and um, and then it can cause diarrhea if magnesium gets in the large intestine. Whereas if you're taking magnesium glycinate, almost all of it is absorbed. Very little will get into the large intestine, so it won't cause diarrhea. So sometimes people need these chelated forms of magnesium so they don't get diarrhea. Most people tolerate the other ones pretty well, though.
Diana said, let's see, my insulin level when I first wake up is 150 to 190 and drops to 120 or lower after eating or excuse me, after an hour of eating. Why and how can I reverse the high AM level?
Okay, you're not talking about insulin level. You said insulin level, and it confused me. So 150 to 190 is a pretty high blood sugar in the morning, but that's the dawn effect. That's the blood sugar going up in the morning because of the cortisol, which makes you insulin resistant and causes uh, your liver to put out extra glucose, and so that's why it goes up. And then an hour after eating, well, now you're making insulin. You're not insulin resistant anymore. The cortisol has dropped down, and so now it drops to 120. But these are all high numbers, so you should still like go to phase one of the program, do phase one, and get that into the 70 to 90 range in the morning. So that would be the best thing to do.
Okay. Lori says, will fasting help lower A1C? Mine was 5.8, fasting blood sugar 95. How should I fast? 3 days a week? Intermittent? A week?
Okay, that's a good question. Okay, so number one is your question was, does fasting help? And the answer to the question is absolutely. Fasting is the single best thing you can do. Everything in your body is repaired when your stomach is empty. And that means empty. That means you're not drinking water. That means you're not chewing gum and swallowing saliva. That means nothing in the stomach. So when your stomach is empty, if you put anything in your stomach, then you stop making ghrelin. Ghrelin is growth hormone releasing hormone. That's what allows you to repair your body and fix everything. So yes, fasting is absolutely. So your next question is, what is the best way to fast? That is a good question. So let me put it this way. Anytime you have an empty stomach, you are repairing your body. Anytime. So anytime you fast is good. If you fast for 1 hour, that's good. 2 hours is twice as good. 4 hours is twice as good as that. And there's no end to that. I have people do 30-day fasts. Can I tell you a story? This guy, 350 pounds, and he can't walk because his knees are killing him. So he has to sit all day in a chair, and he says, there's no way I'm going to lose weight. And there's no way out of this problem that I have. Because if I have food around, I'm going to eat. And I said, okay, so here's what we're going to do. You're not going to have food around. You're going to fast. And so we discussed it. In 30 days, he said, okay, he said he could do that as long as there's no food around. So no food. After 17 days, his knees were great. They felt he was getting up, walking around. He's going, wow, I don't have any knee pain anymore. Now, mind you, he still weighs he's lost 20 pounds, 330 pounds. And he's walking around. He feels good. He has more energy. He's like, wow, this is great. And then his wife makes a big meal for Christmas and just blows the whole thing. So he comes back in to see me. He says, what do I do now? It doesn't matter. Just go back and fast, whatever you want. And the best way is you can do intermittent fasting. That's okay. Eat breakfast, skip dinner. That's don't skip breakfast and eat dinner. That doesn't work. And multiple studies have been done on that. So you have to eat breakfast, skip dinner. And that's one way of fasting. It's called intermittent fasting. Another way of fasting is to do a full day fast, so 24 hours, or eat one meal a day. OMAD, that's great, but make sure it's breakfast. That's actually really important. Then another way, what I do is 3 days, no food, no water, once a month. And that's something I had to work up to. It's not something you just go, oh, I think I'll do 3 days no food, no water. Because your kidneys have to be able to concentrate urine. So you have to train your kidneys to concentrate urine by doing 1 day fast and then eating, and then doing another 1 day fast, and then eating, and then doing another 1 day fast. and it'll train your kidneys to have a higher concentration gradient, so you can concentrate urine better, so that you can do a 3-day no food, no water fast. And so that means empty stomach, right, for 3 days straight, which is an awesome way to repair your body. I went to a conference in December, and it was a longevity conference. And one of the booths there was a cardiology booth where they're testing the, your cardiometabolic age. So what's the age of your heart? And so I'm 61 years old, right? And my test came back 22.5. So my cardiometabolic age was 22.5. There is absolutely nothing better you can do than fasting. And the more you have an empty stomach, the better. And so I've had people fast. There was a guy that weighed 480 pounds, and he lost 300 pounds by fasting. He holds the record for the longest fast. And he maintained his 180 pounds for the rest of his life. And it's really good. There's just no better way to do it.
Yeah. Okay. Jamie says, is organic peanut butter okay by itself and sweet potato?
See, like, everybody wants to know where the line is. Where's the line that I can cross it? I don't have to give up what I love. So sacrificing what you love is what life is all about. No. See, organic peanut butter still has a lot of fat in it. It's got a little bit of carbs, but it's got fat in it. And then the sweet potato is a lot of carbs. So I don't think together them. But peanut butter by itself is okay. Sweet potato by itself is okay. But you know what?
Carbs.
After you eat fat, it's like 8 hours of insulin resistance. So I actually have heard of this. There's one diet where you don't mix fat and carbs in the same day. And I had one patient that did it, and she said she felt great on it, and it worked really well. She lost weight, and she wasn't limiting her diet. There wasn't a limitation of food. It was she would never mix in the same day fat and carbs. So if she had meat, she could have meat and broccoli and salad. And then on another day, on a different day, she would have rice and corn and beans and fruit, but not avocado. So on a meat day, she could have avocado, but on a rice day, she wouldn't have avocado, too much fat. So because it's like 8 hours of insulin resistance when you eat any fat.
Yeah. Okay. Lori said, and following the healthy heart diet, should I be following the diabetic diet?
No, diabetic diets are terrible. If you mean like, if you're like phase 1 of the program, yeah, that's a heart healthy diet. Yeah, that's great, because remember, you want to get insulin down. That's the primary thing for helping your heart, is getting insulin down. Okay.
Go ahead.
So Daryl said his spikes in blood sugar are around 105. You know what? That's okay. 105 after eating, that's not bad. That means your insulin is working pretty well. You're not very insulin resistant.
Okay. So let me see here. Jamie said, will COVID cause neuropathy?
COVID has been attributed to all kinds of things, but neuropathy is one thing that is definitely known. It definitely has been proven to cause neuropathy more in women than men. Strangely, men tend to get cardiomyopathy from COVID, and women tend to get neuropathy from long COVID or the vaccine. The vaccine does the same thing long COVID does, makes spike protein.
Okay. Lori said, should I take the heart healthy supplements while fasting?
Oh, no, you don't take any supplements. Remember, the supplements are food. You're not fasting if you're eating food. So So think of that as eating. So no supplements, and most medications should be avoided as well. But you have to be careful with some. Like if you don't have a thyroid gland, then you don't stop taking thyroid medication. You keep taking it.
Yeah.
So some medications you're going to have to keep taking, and so depending on what you're on, you may have to ask your doctor. Uh, uh, Although that's kind of funny because the doctor's not going to know. I always think that's so funny. You go to or you're watching something about a nutrition thing. Ask your doctor. Doctors don't know anything about that. How do you ask your doctor about something that they're ignorant of?
Right.
I
And
don't know.
that does remind me, I don't know that we ended up doing a disclaimer, so I'm just going to say this. Dr. Saunders is a great doctor, but he is not your doctor. So make sure that you talk to your medical provider before you implement any of the things that we're talking about today.
Yeah.
Uh, Diana said, okay, so high blood sugar on waking. I was told if you take fiber before going to bed, with vegetables or take fiber powder.
Okay. High blood sugar on waking. Okay. So in order to prevent the morning effect, to eat fiber I eat fiber at night. I don't. You know what? It's better to have an empty stomach at night, and then in the morning, if you have high blood sugar in the morning, it means you have insulin resistance, or a lot of stress, and so you should deal with the insulin resistance and not try to work around it by adding fiber at night.
Okay. Anonymous said I did a 24-hour fast. I had cotton mouth so badly that I did drink water. Is it normal to get cotton mouth? I haven't heard anyone mention this.
Yeah, yeah, of course it's normal. You get dehydrated, you're not drinking anything. And food has a lot of water in it. We don't think about that often, but you eat an orange and 90% of that orange is water. so so between the food and the water, you're getting a significant amount of water. And then you're fasting, you're not getting any of that. So then you get cotton mouth, and then that's dehydration. And you know what? It's okay. Sip a little bit of water, and then the next time you fast, you'll be able to go longer. And the next time you fast, you'll be able to go longer. And then the next time you fast, you'll be able to go longer. And so it's okay.
Okay. Cheryl said, how often should we be doing these lab tests?
Okay, you just need them once to tell you what the problem is, because that's really all the lab tests are for, is where's the problem? Do I have a pancreas problem? Well, if you don't test, you don't know. So the purpose for the test is to find out where the problem is so that you can do the right thing. And then any other test that you do after that is academic. Academic meaning is just for information. It's not for helping you.
Let me see here. Okay. Kimberly said, when fasting, is it okay to eat nothing for 12 hours, or is black coffee or tea okay?
It's okay to eat nothing for 12 hours anytime you want. But technically, black coffee, black tea, and water don't. Well, they do break the fast in the sense that you put something in the stomach, you stop making ghrelin, but they don't break the fast in terms of calories. So you're not going to make insulin, which is a big deal for those with diabetes. So yeah.
Okay, there was a comment here from Jamie. Not the same day. Is it okay?
Yes. Yes. Yeah. Not the same day. So if you have your organic peanut butter on a different day than you have the sweet potatoes or yams, yeah, that's fine. Yeah. Yeah. No problem.
Okay, Shannon said, when I did a 10-day fast, by day 7, I was really, really dizzy whenever I stood up. Low something. Very little water. How can I mitigate that? Oh, low blood pressure.
Yeah. Low blood pressure from dehydration. But also consider you may have been having hypoglycemia and your blood sugar could have dropped low. These are things that your body will equilibrate. And so you just sit down, ride them out. It takes 30 seconds to a couple of minutes, and then you get back up and move on. And it's okay.
Okay. That's it for today. Thank you
All
so much,
right.
Dr. Saunders. See you tomorrow on the Home Cues That Work webinar.
Ashta